Now, what we want to do before we start to bend the knee is relax all the muscles around the knee itself, because especially after surgery, these muscles can be really spasmed and reactive and guarded and prevent you from accessing the ranges. So the first thing we want to do is relax the muscles. And one of the primary muscles to relax when it comes to the knee bending is your quadriceps muscle. So your quadriceps muscle is a big muscle group. It lives right in the front of your thigh. And what we want to do is just do some light strokes down the length of the muscle group itself, and we want to attack the muscle from multiple angles and multiple directions. So what we want to do is you can start on the inside, and I would spend 30 seconds or so inside and then move to the center of the muscle group, and you can adjust your pressure as you need. So you can start really soft because it might be a little sensitive, and then start going deeper into the muscle fibers as your sensitivity allows. And then we can move on to the outside part. And I'm just using my thumbs, kind of a wide grip here. You can go a little bit more focused with your thumb pads as the tolerance allows, but it's really sensitive. Keep your distribution broad. And then you can go up the leg as well. Attack the muscle fibers from different angles. Nice sweeps. You can then do a little bit of circles. I'm just working my way down the quad itself. Circles, the inside, middle, outside. So spend a couple minutes on this. Really get this quadriceps to relax. Calm down the tone of the muscle, the spasms. You can use broad sweeps with the palms of your hands. There's no perfect recipe for this at all. Just consistency, building up the tolerance. And then you can even work your way down the leg as well. I would do one hand at a time, work the side. There's a lot of structures in the knee after a knee replacement that can really get sensitive just because of the trauma. And so just a little bit of stimulus here can do a lot in terms of just calming these structures down. So big open palms here, just kind of massaging the sides of the leg, going to tolerance. Recovering from a total knee replacement or getting ready for surgery, rehab can be confusing. You're not sure what exercises to do, when to push, or how to manage pain and swelling. That's exactly why we've created the Total Knee Replacement Rehab Guide, a step-by-step plan to help you reduce pain, regain motion, build strength, and move more confidently again. Whether you're working with a physical therapist or going at it alone, this guide gives you a clear roadmap so you're never left guessing. Click the link to get instant access, and let's make your recovery smoother, smarter, and more successful. So muscles that can really restrict our ability to straighten the knee is our calf and our hamstring. So the muscle in the back of the thigh and the back of the lower leg. So a little massage is good to introduce to calm down the spasms and the tightness back here and the sensitivity, so that we can move our knee a little bit more effectively to achieve full extension. So the first thing we're going to do is really just put our leg in a position of relaxation. So this could be just like slightly bent like this, supported if you want. You could even do it sitting in a chair. But the knee is slightly bent so that we're not guarding already. We want the leg to be really relaxed. So we're going to start at the calf, and we're going to take some broad contacts using our hands, and we'll just do some linear strokes up the length of the calf itself. We're going to go start with the inside. You can do like 5 to 10 strokes, and then we'll move to the center, and then the outside. And then we can change directions. We'll go down the length of the muscle. And you can try to hit all angles of your calf. Try to get the inside part, the outside part. And in terms of length of time, I would spend a solid minute to 2 minutes per muscle group. So we can hit that calf first. And if you have a rolling pin at home, or even a massage tool made for relaxing muscles, you can roll up and down the back of this leg too. That can be a really useful tool. So if you got a rolling pin at home, you can utilize it for the same purpose here. And then you can do some circles using both hands, just working the length of the inside and outside part of the calf. And you can build up pressure as your sensitivity allows, and we're just working our way up and down until our fingers start to meet in the middle. Then we can work our way up to the hamstring, working our way out the inside part, starting all the way down where the hamstring's attached into the back of the knee here. So you're going to feel some of the tendons back here, and then just kind of gradually build up some force as your sensitivity allows. And we're just trying to relax this muscle group. So that's this nice sustained soft tissue massage, going deeper as you can tolerate, working all parts of the muscle fiber itself. Maybe spend a little bit more time over the more sensitive areas, attacking all aspects of the muscle group. And then we can do our circles and some squeezes. And so spend about 2 to 3 minutes per muscle group and building up intensity as your symptoms allow.